10,000 people turn 60 each day in America. With these numbers comes the complication of mental decline. Is this decline due to getting older or to addiction? Dr. Harry tells us about his book, which addresses these challenges.
I published a book about 2 years ago with AARP entitled Not as Prescribed. In Not as Prescribed, we draw a great deal of attention to especially early cognitive difficulties in the patient, disturbances in mood, memory, and just the ability to figure things out. That can also happen when they're using an addictive substance. So they parallel each other, and we see them often together. I addressed the drug crisis in older adults, polypharmacy, people getting multiple medications from many physicians, coming into treatment with as many as 10 or 12 different medications from different physicians, some of which have cross reactions that are negative. Trying to unmask the difficulties of aging and substance use disorders in the aging population. Not only do you have more birthdays, but your liver does too. Oftentimes the family is unaware that part of the problem is chemical. And when we discover that, magic happens.
Dr. Harry tells us about his patient, Bo.
Bo is one of my favorite patients. He's got a great story and really fits right in with Not as Prescribed in that demographic. Exposed to prescription medications for valid surgical reasons. The medications got him into trouble, and you'll hear the rest.
I got a knee replacement, and I got 2 shoulder replacements. And I would always get back into the pain medication. And that was, it wasn't about the knee anymore, it wasn't about the shoulders anymore, it was basically about the opiates, about what it was doing and how it was making me feel. In my second marriage, my first marriage was divorced over the same thing. I was looking at another divorce. There was nothing left. It was just that I was physically and mentally bankrupt. I just was living in a black hole.
Bo tells us about his recovery.
Dr. Harry, he plays a big part of my whole recovery. He was able to talk about the science of the mind and how the brain functions. And he explained that to me in the layman's terms that made sense to me. And that's when I started following his program. And it has worked to this day.